All right, Dr. Wilbanks, thank you so much. I'm so excited that you're going to be speaking for us. Can you tell us a little bit about what you're going to be speaking on?
Yeah, so I'm going to be talking about basically introducing people to the world of cranial work and the craniopathy.
Yeah.
So craniopathy is like a little subsection of SOT that I use in my office every single day. That's like our niche that we specialize in, and so it's magic. It's great.
Awesome. Yeah, I use cranials as well. I think it's a
Cool.
solid
Awesome.
tool to have in your pocket. Yeah,
hmm
for sure. That's so cool. And what got you into chiropractic in the first place?
So I was looking around and I knew I wanted to go to medical field of some sort. I've got family that have issues of chronic pain, this and that. And I thought I wanted to do med school. That didn't turn out like I wanted. I thought I wanted to, but I didn't. And so then I was looking to the alternative side, physical therapy, PT, chiropractic, and then went to my first chiropractic adjustment in undergrad, and it was like a night and day difference. And I was like,
Heck
oh
yeah,
well, I know what I'm doing. So I
absolutely.
went and toured Logan, and I didn't go anywhere else.
That's so cool. That's
Yeah,
awesome.
yeah.
That is awesome. So you do a lot of cranials. What would you say is like your general patient demographic? Do you see everyone? Do you have a majority of people that you see?
So yeah, we pretty much see everybody. I've seen anything from a 3 day old baby up to a 94-year-old, person.
Yeah.
But in general, with the cranial work, we do a lot of rehab with any kind of brain trauma, concussions, chronic headaches, migraines, those kinds of things. We see a lot of patients in the St. Louis area or even a couple hours out of St. Louis who will drive routinely to get treatment because there's no one else that really does what we do, and they've seen everyone else already and they've had no success yet.
Totally, totally. I totally get that. That's
Mm-hmm.
awesome. And would you say that like cranial, I feel like in school they teach us that, at age 25 or whatever, your bones ossify and stuff like that. And I feel like that's crap, but maybe that's just my opinion. Do you feel like you can move cranials on adults and above?
Yes. So via the book, yes. Cranial sutures fuse at age 25. So your cranium is pretty solidified at that age. However, you do have what we call intra and interbone motion that we're assessing and working with and those kinds of things. So we're working with the
Cool.
pliability sometimes of the cranial bones as well. There is still microscopic amounts of movement. So we've got a few different doctors here in the St. Louis area that have done research in people well in past the age 25, and they have seen changes in where they are kind of doing angulations of the cranium and seeing how it's changed and how it's shifted before blocking, doing any kind of cranial work and seeing changes and seeing how it's becoming more balanced, even say age 40, 50.
That's so cool. That's
Yeah.
awesome. What would you say your favorite patient case is as far as like cranials helping with this one case?
Oh, so a fun one that I like telling is I had a patient who came in once who he didn't tell me until like visit number 3 that he had tinnitus. He's had tinnitus for I think it was around 7, 8 years. Chainsaw accident, he's on chainsaw all the time, and it's just very loud, noisy environment. He came in for low back pain. It was a personal injury kind of case, and we were treating that. Well, third visit, he said, doc, last time you did something a little different to my head, and I've had no ear noises since. And I'm like,
Okay.
well, I wish I knew that before so I could document it and know exactly what we
Well,
what
we
what
did.
we did. So I'm
Yeah.
like, okay, so well that's just one of the ones where you didn't even know you were treating tinnitus and
Right, right.
it
It
fixes
just
itself.
self-resolved. That is
Yeah,
so cool. Yeah, and especially for something that the medical industry says is uncurable.
right.
That's so
Yeah,
cool to hear. Yeah, that we're
yeah, and
helping
that
that.
was 5 years ago, and he hasn't had it since.
That's amazing. That is so cool. Well, I'm super excited
Mm-hmm.
to learn from you. And this is like an all technique, basically based seminar. So it's going to be
Yeah.
really cool for everyone attending. I'm super excited. I get to learn
Mm-hmm.
from so many different docs. And I feel like once we're out of school, we the more technique, the better, right? Like we've got to stay sharp in all different kinds of ways. So I really think this is going to be a huge addition to the seminar. So thank you so much.
Yeah, of course. I know I am actually excited for one of the other instructors who's doing the extremities, Dr. McCallie. She's awesome.
Yeah.
She was in my class at Logan, and yeah, she's phenomenal.
I love her. Yeah, she's awesome. Super exciting. All right. So we're going to wrap this up. I just want to thank you again, Dr. Wilbanks, for your time. I know our time is hard to come by, so thank you so much for giving it. And thank you so much in advance for in June giving us your time and your weekend there. I'm just going to, as a general reminder, if you guys haven't signed up for the mid-year rev up, it's going to be June 9th and 10th in Glenwood Springs. You can check our website or check your inbox for it. And you're going to want to get signed up. We got a lot of awesome speakers, including Dr. Wilbanks, and we're going to be super excited for it. So you can reach out to us, but get signed up.